So, all right. I'm kicking us off for our first one. Okay. So those who stuck around for the first part, some of this will be a refresher in the beginning, but then we'll dive right into our Southwest and West Central Virginia regional data. I am Amanda Holcomb. I'm the Director of Community Engagement for 211 Virginia at the Council of Community Services. And just as a reminder, 211 Virginia is a contracted service of the Commonwealth of Virginia through the Virginia Department of Social Services with an annual appropriation from the General Assembly and operated by the Council of Community Services, which is our employer, and a nonprofit organization that is headquartered in Roanoke, Virginia, which is in Southwest Virginia region, that has, of course, a statewide presence with 211 Virginia. So we do appreciate you being here today, and we'll roll right through these two regions. So first, I have the pleasure of introducing my home, the Southwest region. The Southwest region is made up of planning districts 1, 2, 3, 4, and 5. So you'll see Lennowisco, Cumberland Plateau, Mount Rogers, New River Valley, and then the Roanoke Valley, Allegheny, with all of those localities within counties and cities. So the Southwest region houses 28 counties and cities across those 5 planning districts. You can see on our map we have a great geographic area when it comes to our reach in Southwest Virginia. And right now, we are in the process of hiring and interviewing for a Southwest Virginia community engagement specialist. I've kind of been doing both of those roles, and we know that that's so important to get out in these communities, especially in our far Southwest areas too. So looking forward to that also in 2025. Big year for 211 Virginia.
All right, and then today I have the pleasure of introducing our West Central region. So this is one of our smaller regions of just 2 planning districts and 11 counties and cities. You can see them highlighted in orange on the screen. And among these 11 counties and cities, they are supported by over 550 agencies listed in our directory.
Oh, I think I missed that about Southwest. So Southwest is supported by over 800 agencies listed in the 211 Virginia Resource Directory, which just means that they are physically located within those regions. So about the data, if you were just in Mary's session from 9 to 9:30, you can recite it along with me as our Director of Data says. But just kind of touching that again, throughout the presentation, we're going to be referring to these following data points. The term agency refers to an organization with at least one program of service listed in our resource directory as of June 30th, 2024. The term program listing refers to a specific service provided by an agency that 211 Virginia can refer individuals to. One agency can have multiple program listings. So you have your agency and then you have the program listings that follow with that. When it comes to our program types, we are going to also refer to them as keywords at times that describe services classified under one or more of our Inform USA taxonomy terms. And so Inform USA is really that best practice for information referral. We are an accredited 211 Virginia system, and we have accredited and certified database and contact center, as well as certifications within our staff. So Inform USA is super important to 211 Virginia. We use around 440 keywords that cover 700 plus taxonomy terms. And so then with our individuals and inquirers, also an interchangeable word is that estimated number of unique people who contact 211 Virginia 1 or more times within our fiscal year of 23 and 24. So that's kind of our data set that we're looking at for the most part within our presentations today. Contacts is the number of calls, texts, chats, emails, postal mail, or face-to-face interactions handled by a 211 Virginia Community Resource Specialist in that fiscal year. And then our referrals given is the number of resource referrals provided in our fiscal year. There may be multiple requests per need. And on average, our community resource specialists like to give three referrals per need whenever possible, just so people have more than one option. Of course, if that doesn't work out with the three, they're always welcome to contact us back for more referrals if they are available. Then we're also going to look at population. We're going to look at median household income, percentage of households in poverty, and then percentage of ALICE households, just to help contextualize some of our data when we're looking at those different kind of data points that may influence or kind of give us reasons to why the data may read a certain way. So if you're not familiar with ALICE, ALICE is a term within our United Ways. And so we're going to be looking at United for ALICE's Virginia report data, or not looking at, but referencing that data, which ALICE just stands for that asset limited, income constrained, employed kind of household or individual. And really that represents the growing number of families who are unable to afford basic needs but have an above income above that federal poverty line. So you'll hear us refer a great deal to ALICE households because you're probably seeing the same thing. There are different types of needs now. And so prevention services are needed more than ever. Addressing issues are needed more than ever when it comes to this population who are employed, but they still cannot afford to meet the basic needs. And so the United for ALICE report, you're welcome to and encouraged to reference any of that if you're curious. And most of this data is also going to be cited from the U.S. Census Bureau as well. So diving into community utilization, we'll start talking about just community utilization of 211 Virginia refers to our number of contacts and unique individuals. So really, quite literally, who is using and engaging 211 Virginia. So in our Southwest Virginia region, so just to remind you of the map and where we're talking about when we say Southwest Virginia and for 211, we have over 830,000 estimated number of people living in our Southwest region. From there, we had over 8,700 contacts. So again, whether by phone, email, chat, or text, every contact is counted. And this is really a number that we use to indicate the number of needs in your area, or kind of representing the need in the area. And so if you were around for the former presentation, you kind of understood that contacts and individuals may look different, because an individual is the estimated number of unique persons. So one person may call us 2 times, 4 times, and then we also kind of consider the anonymous calls, since we are such a low barrier, easy access service too, when we think of this number. So this is probably the biggest discrepancy you'll see within our contacts and individuals throughout the day. And we have some reasonings that we think, because the Council of Community Services is in the Roanoke Valley. You'll see some of our numbers within Southwest Virginia and kind of gauge where some of the awareness is really, really great in some of our areas within this region.
Hopping over, once again, I get the pleasure of presenting for our West Central region today. So in that West Central region, which is right next to Southwest, we got our neighbors together. There's a population of just about 500,000, and again, that's between those 11 counties and cities. From those 500,000, we received about 6,400 contacts, and those were spread among just under 5,000 individuals. So you'll see we actually had more unique people use 211 Virginia services in West Central than in Southwest, but they were using us less often.
So next, we're going to look at our contacts by planning districts. Identifying planning districts with the greatest demand can inform resource allocation and highlight those opportunities to expand our outreach. So this might not be surprising to you all, but I think just to call out specifically, we can see that the dark blue is those localities with the highest number of contacts. So in some cases, they are a little bit of half of the contacts from that planning district, or way more than half when it comes to Planning District 5 and the city of Roanoke. And so that, just a reminder, the dark blue is the localities with the highest number of contacts, and then the light blue is all other localities within that planning district. And so you can see where the total numbers are, but then you can see where Scott County for Planning District 1, so Lenawisco, Planning District 2 within Tazewell County, Planning District 3, Washington County, Planning District 4, Montgomery County, and then Planning District 5, the city of Roanoke. So I was kind of surprised that this didn't look like a stair step, and that we kind of had more from Planning District 3 followed by Planning District 5 when it comes to our contacts by planning district.
And then West Central is a little bit easier. There's just two to look at, so that makes it pretty simple. We're not super surprised by this data either. The city of Lynchburg, obviously, we know is one of the more well-populated areas in West Central, and so we are seeing more contacts there than almost anywhere else. You can see we had almost as many contacts just from the city of Lynchburg as we did in all of Planning District 12. So definitely a large area for us. But Planning District 11 has definitely more contacts, again, with most of those generated from Lynchburg. And then in Planning District 12, it's a little bit of an easier, more even spread between the localities, but we did have the most contacts from the city of Danville.
And then to put it all together in a map, just to kind of show you the spread of contacts of 211 from each locality, you can see that the Southwest Virginia and West Central Virginia does not have any number of contacts at 211 Virginia in our fiscal year above 5,000. So you do not see any red. I promise you, if you stick around all day, you will see red, but you do see a little bit of orange from that 1,000 to 499, again being in Roanoke, the city of Roanoke, and then Lynchburg City. We can also say not only are those populated areas, we can think about historically the 211 presence and outreach in those areas as well, being that we had a center in Lynchburg for quite a long time. So anecdotally, we can kind of think where awareness has happened in areas greater than others, but then also we'll look at the population and all of those things that can inform some of the reasoning. You will see a lot of yellow, the 300 to 999 in these areas, and then a great deal of green, and then just a little bit of that light blue. So we're looking at Craig County, Floyd, Bland, and Grayson. So all of those fall within the Southwest Virginia region. And then looking at planning district contacts relative to population, we're going to see, again, when we think to kind of add some context for this, you see in this column, we have the number of region. So the percentage of region that this population makes up. So Lenawisco makes up 10% of the Southwest region, Cumberland Plateau, 12%. Mount Rogers 22, New River Valley also 22, and then Roanoke Allegheny 34. But then what's really interesting for us is to consider that regional population and then look at the regional contacts. So who's contacting us from that region? So we want to see these numbers be a little balanced. And so Lenawisco, 6% of that region is makes up our regional contacts, 8% from Cumberland, 15 from Mount Rogers. And then where it gets a little lower in utilization is within the New River Valley, with them making up 22% of our region's population, but 12% of our regional contacts. So that kind of lets us know we might be able to do a little more awareness in that region. And then completely opposite, we have the Roanoke Valley Allegheny region that makes up 34% of our population, but 60% of those regional contacts. So again, we can think historically, the increased awareness, how long we have been in these communities, how long we've been known in communities, but also looking at population and need as we go into the presentation more, I think will help provide some context as well. So just to highlight, percentages that are significantly different indicate that the planning district uses 211 Virginia either much more or much less than other areas in their region.
And then once again, when we only have two planning districts to consider, we're not going to see as big of a difference, but we can see kind of similar to what we were expecting when we looked at contact volume. In Planning District 11, that represents 52% of the West Central region's population, but makes up 64% of the contacts, so slightly overrepresented there with high utilization. And then we see, of course, the reverse in Planning District 12, with 48% of the region's population, but only 36% of contacts, which, as Amanda said, can indicate that that may be an opportunity for us to do some more outreach, raise awareness in that area, or examine why that area may be contacting us less often than the other.
All right. So next we're going to look at localities with the highest number of contacts relative to population. And so this data is going to showcase those regionals contacts with the number of contact relative to their population. Same thing, but now looking at just the localities. And so, of course, no surprise, we're going to see our city of Roanoke, city of Lynchburg on here as we have referenced them within how many people contact us from there. And so 12% of our region's population is from the city of Roanoke, with 42% making up 42% of our regional contacts. So that is very high utilization when it comes to the city of Roanoke. Same with the city of Lynchburg, making up 16% of our region's population, and then 39% of our region's contacts. So again, higher, showing higher utilization. And then it kind of starts to level out more with the other localities within the city of Martinsville, with 3% of our region's population and 7% of our region contacts. And Appomattox County, again, 3%, with 5% of our region contacts. And then our city of Salem, so one of the Roanoke Valley planning districts that's not the city of Roanoke, getting called out here at 3%, with making up 4% of our region's contacts. So areas where the percentage of contacts is significantly higher than the percentage of population are more likely to have that high awareness of 211 Virginia and have perhaps a higher community need as well, especially when we think about our more populated and more urban areas of our Southwest and West Central Virginia region. And then on the flip side, the localities with the lowest amount of contacts relative to population. So we're really looking at this and looking at areas where we want to increase awareness of 211. So Bedford County, Pennsylvania County, Montgomery County, Franklin County, and Roanoke County are called out as the lowest amount of contacts relative to their population for localities within these regions. You can see that these are pretty much 11, 12%, 16% of our region's population. And then you see it's mostly less than half of that being a percent of regional contacts. So we're really looking at with that 16%, but only 6% of their region of that locality makes up our regional contacts. Same with the 4%, 5% with Montgomery County, 7% with Franklin County, and then 9% with Roanoke County. So we can kind of assess that areas where they're significantly lower in contacts and population are more likely to have low awareness of 211 Virginia or that lower community need. And so when I look at this, and probably if you're in these areas too, you look at this, you think of those Franklin County has Smith Mountain Lake, per se, when we think about community need and where maybe some more wealthier areas are within this region, where maybe more home ownership is happening versus rental in some of these regions too. So there's a lot of different data that can kind of inform when we think about the lower community need. Or it could just be low awareness. So then again, to map it, 211 Virginia's contacts relative to their population, when we look at percentages of statewide contacts relative to the percentage of statewide population, again, you'll see this is again where City of Roanoke and City of Lynchburg are going to pop out as very high 211 Virginia contacts relative to population. Then you'll see the City of Martinsville being that lighter peachy orange color, also relatively moderately high. And then we don't have the dark green anywhere, so we don't have any very low, but we do have quite a bit of the other two greens of moderately low and somewhat low in these areas. So definitely looking at Wise, Washington, Montgomery County, pretty much all of Roanoke Valley with the exception of the city of Roanoke, Bedford County, and Pennsylvania County within the contacts relative to population. And then I think this is our one and only line chart that we have in our presentation, so it might pop out to you. Sometimes people like to see our contact volume over time, knowing that we're working on our fiscal year. And so reviewing the contact volume over time can offer insights into the shifting community demands on both a monthly and annual basis. Now, we've been around for a long time, so these charts pretty much trend the same way year over year, with the great exception of COVID for the last 1 to 3 years that we were responding to that. These line charts have pretty much trended the same way throughout the state. Overall, contact numbers were highest from August to October. Contacts from Southwest Virginia also spiked in July 23, January 24, June 24, and then contacts from the West Central Virginia spiked in July 2023. So we can contextualize this when it comes to like the DSS assistance programs, when it comes to fuel, energy, cooling assistance programs. They have windows of when you can apply and when you are notified. And so that can kind of speak to some of this. We have tax season that can speak to some of this seasonal things like back to school, holidays. So there are some things that we can kind of know year after year where we're going to trend based on what's happening throughout the entire state, which usually mirrors each region too. So, in summary, on community utilization, before we move on to our next section, utilization at 211 Virginia appears to be low in counties that are more rural or wealthier than others, as we kind of said earlier. And the majority of our contacts from this area originate from those population centers, such as the city of Roanoke and city of Lynchburg within the Southwest and West Central regions. And then the area of Virginia matches statewide trends and contact volume overall over time, with the highest amount of contacts coming in from that August to October. So now we'll transition to talking about community needs. So we're going to start by looking at some of our numbers from United for Alice, just to kind of contextualize some of the data when it comes to income and poverty levels within our regions. And I will note just how beautiful the Southwest region is when we pick out some of those pictures too. We love all of our mountains that we have within Virginia, but especially Southwest. So 18% average of households are in poverty. So this is those that are living below the federal poverty line. And then 34% of Southwest region average Alice households. So again, those are those asset limited, income constrained, and employed, and represents the growing number of families who are unable to afford those basic needs. And then in 2022, the median household income in Southwest region was $51,548.
And then West Central, we're going to see it perform pretty similarly. These two really are neighbors and act like neighbors. We're going to see that percent of households in poverty come down just a little bit to 17% on average across the region. The Alice households stays the same with 34% on average across the region. And then that median household income is just a little bit higher in the West Central region, coming up at just under $55,000.
So then we're going to compare our planning districts to our state and regional averages, kind of look at that. So our state averages a percentage of population under Alice threshold. So these include those that are employed, but then this number also includes those living below the federal poverty line. So this is a whole number there. Our state average is 46%, and our regional average is just slightly higher at 53%. And then you can see where all of our, with the exceptions of Mount Rogers, New River Valley, and the Roanoke Valley, the others are a little bit higher. So Lenawisco and Cumberland Gap, both at 60% of their population under Alice threshold. So we can tell there a little bit of community need based on those numbers. And then Mount Rogers at 52%, and then the New River Valley and Roanoke Allegheny being 45% and 46% of those.
And in West Central, we are going to see a little bit closer to the average in terms of regional is a little bit closer to state. Again, that state average is 46% of households that are under the Alice threshold. And to reiterate, those are our individuals or households that earn either below the poverty line that's included in this group or are an Alice household. So that's both of those. This number kind of represents anybody who can't afford the cost of living in their area. So at the state, about 46% of people can't afford the cost of living. In the West Central region, we're looking at about half. That's lower in Planning District 11 with only 47% of the population, kind of right on par with our state average. And then in Planning District 12, that's 53%. So anytime we see that number coming over 50, that's kind of a little bit of a red flag for us that we may see more community need in that area, because that means that a majority of the population in that area cannot afford the cost of living. So those over 50s are a little bit of a red flag for our team in terms of need.
And then are calling out some specific localities with the highest percentage of population under the Alice threshold. We're going to see the majority of these being within the Southwest Virginia region, Buchanan County, Dickinson County, Lee County at that 67%, 64%, 63%. City of Martinsville within 61%, and then City of Norton 60%. And as Mary said, anything that's above 50%, we're really looking at. And as we kind of noted in our earlier session, this really struck me as someone that's in Southwest Virginia, and that we know that these specific counties also were hit pretty significantly by our Hurricane Helene. And so when we think about someone's ability to be resilient on top of having a disaster, on top of not being able to meet their basic needs, that is really concerning for us. And we are grateful to be able to get those resources out there and have those being accessible, but understanding that when something happens immediately, that some of these people are going to be in immediate need and in dire need during these situations because they're already having trouble meeting their basic needs. So I really think about Buchanan County and the regions that surrounding them that a couple years ago had a flood and now have Hurricane Helene too. And so that is something that definitely comes in mind when we think about having these resilient communities and also the various factors that they can be affected by. And then our localities with the lowest percentage of population under the Alice threshold, Bedford County, and again, some of these kind of mirror utilization too, which makes a lot of sense when it comes to low need perhaps. So Bedford County, Roanoke County, Botetourt County, Giles County, and Franklin County within that 37 to 40% population under Alice threshold. So well below, in most cases, the 50% and below the state and regional averages here. And those communities, and again, to reference some of the things that these communities may have access to, may have some equity in home ownership. There's less rental in some of these areas, and then kind of noting those pockets of maybe retirement communities that are in some of these areas too. So there can be a lot of various things that can inform what's happening within our populations, especially when it comes to their income. So again, to map it out, we do see a lot of orange in our Southwest Virginia and West Central Virginia region that indicates 53% or higher population living under the Alice threshold. And so that is where we kind of recognize that we need this awareness. And as a community and as a sector, this is really where we need resources, and we need to look at how we're helping people and preventing people from becoming, under the federal poverty line if they are Alice populations too. And then kind of noting that we only have one county within Southwest and West Central that is below that 37%, and that's Bedford County too. So continuing with community need, and this is kind of where I think we like to live because it's how we get to help people. So we saw who's contacting us, and we saw kind of the makeup and contextualize some of the data. And now we're going to see how 211 Virginia provides that help. And so our best way of kind of indicating that is our referrals given and how we're able to connect people. And so for the Southwest region, we had over 17,800 referrals given through that fiscal year. So that means each program listing we provide someone is considered a referral, and the referral represents the amount of assistance that was available. So thinking back to where our community resource specialists try to give at least 3 referrals per need. You can kind of imagine what that looks like with these numbers. And then our kind of way to measure success is with this average referral success rate. Within Southwest, it's 87%. And the math on that is referrals given over the referrals given plus referrals not given. So you're probably thinking, well, what about the 13% that wasn't successful? And so sometimes a referral search does not always result in an accepted referral. In these cases, we document it as a referral not given. And so when we document the search type, location, and reason we were unable, and then we document it. So we look at the search program type, their location, and the reason they're unable to provide a referral. And so this really the bullets are the reasons that a referral cannot be given in most cases. So no program matching the individual's need or location were available in the directory. So we may not have it, or it simply might not exist. So that is something that we're going to look at in data when it comes to those referrals not given. The individual can end the call or refuse the referral if the referral is not a good fit for them. Maybe they've had them in the past and it's not a good fit. Maybe it doesn't align with their values, or maybe they know that they're not allowed to be in that program anymore. And so there are multiple reasons that are kind of unknown when it's why someone would refuse a referral. The most common is that the individual is ineligible for matching programs. As we're talking about Alice population and not being eligible for those programs that are for those that are living below the federal poverty line, that Alice population can sometimes get completely missed in a lot of our eligibility. So that's something that we hope is a takeaway from this, is how we can look at our eligibility, how maybe we could get some additional resources to kind of fill these gaps to meet those next income levels that are in great need too. Because I think that's probably the biggest barrier, is someone makes a little too much money for the program, or it's just not, they're just not eligible for that program. And then, of course, the individual was too far away from any matching programs. You will see us reference transportation in a few slides, but sometimes they're just too far away, especially when we think about a lot of services being located within those populated cities, that if you're in the rural communities, you might not have a way in to access those services. Though we will say in our communities, and as you've probably experienced too, a lot of mobile services where we bring services to the people have popped up within the last 5+ years. And then also we're seeing a lot of these envision and empowerment centers and kind of these one-stop community accesses coming into these lower access communities as well, which is really, really great to see. And then the individual already used the matching program. So if we can't send them to something that they can only get in for maybe one time a year, or they've already used that, we see sometimes where with utility assistance or rental assistance that a program may offer to pay a portion, but it's up to the individual to then fulfill the rest of the portion. So we're not going to refer them back to that program, which I think is really important to know, that we know these eligibilities and really do try our best to give good referrals to people, because we can give referrals all day to people, but if it's not a good fit, we're not helping anyone in those situations. So again, highlighting that in this region and throughout the entire state, the individual is ineligible for matching programs is always going to be the top reason for a referral not given.
And then in West Central, we're going to see a similar number of referrals given. So it's going to be just under 17,000, somewhere around there. And once again, that's every program listing that we provide. That's considered a referral. And we do see a higher than average referral success rate with 91%. And once again, like Amanda was saying, those kind of more urban areas or populated areas tend to kind of be also clusters of services. So we know that the city of Lynchburg especially has a great deal of services and great working nonprofits that are available. But clearly it's not the only one. There's lots of great nonprofits throughout the West Central region that allow us to achieve that 91% success rate.
Then looking at the referrals given and the average referral success rate, per planning district, and then comparing those to this, well, kind of comparing, just referencing, can't really compare to the state average, just letting you know the state average and then the regional. So for the state, we provided close to 267,000 referrals through our entire state with an average success referral rate of 88%. And then within the Southwest region, over 17,800 referrals given with that 87% success rate. So you can see that kind of like in school, the fewer assignments you have, maybe the lower grade or the higher grade, depending on how that works for you. So you will see within Lenoisco, the referral numbers just being 750 gave them that average success rate of 80%. And then on the flip side, within the Roanoke Valley Allegheny, over 10,750 referrals, giving them that 90% average success rate, and kind of seeing everything in between. But for the most part, they've exceeded or stayed in line, with the exception of those two planning districts.
And then once again, I get to deliver some good news about West Central. So you'll see that state average again is 88%. Regionally, the West Central region exceeds that average with a 91%. In Planning District 11, it exceeds with a 92. And in Planning District 12, we're seeing 90%. So again, there's about double the amount of referrals given in Planning District 11, but we're still seeing that high success rate in Planning District 12 as well. So we can feel pretty good about our ability to give referrals in both of these planning districts.
And then to map it out where there's number of referrals given, in Southwest and West Central, we do not have any referrals over 15,000, so you won't see any red. But if you stick around today, you will see red on other parts of the state for sure. But it's kind of funny how it's chunked out throughout Southwest and West Central pretty evenly, where we have our orange from 5,000 to 14,999, and then kind of the middle of Southwest and West Central, we have the 1,000 to 2,999, and then at the tip we have less than 1,000. We also kind of acknowledge, being in the far southwest area, that they are in that tri-state area, and so some of their support, especially when we think of Bristol City, really is in, I mean, they have the Tennessee so close to the line, and then West Virginia and other parts too. So, and then North Carolina, of course. So some systems just look different depending where we are too. But again, speaking to where we could do a little more probably awareness to our services. And then, so kind of lined up with school. So we gave some grades when it came to average referral success rate. So anything 93% or higher, we're giving an A, all the way to orange, less than 80%, giving a C. So Southwest Virginia and West Central Virginia, we are all B minus or above students here in these localities in our planning districts. And so you can see again with the Wise County and Scott and Lee, I believe. You can see where they're 80 to 82%, and then you'll see a lot of good green area, 90 to 92%, and then this pocket of the 83 to 89% average referral success rate. But overall, throughout the entire state, you're going to see our success rates 80% or above, which does show a good resource allocation, but we know we have more work to do too. So in summary, the percentage of households living under that ALICE threshold is very high in this area of Virginia, especially in planning districts 1, 2, 3, and 12. Planning districts 1 and 3 had the lowest average referral success rate overall, indicating that potential resource scarcity in those areas. So looking at maybe where resources don't exist, or that we need those resources within our directory so we can refer people to those helping services as well. So it's kind of a and or both situation. And then we'll look at our referrals by needs categories. I think that this is what everyone likes to see because you can see all of those needs categories that we use, and then the referrals given and the referrals not given. So really looking at our referrals and success rates broken down by needs category. So the slide shows the number of searches we made for referrals in each category. So the blue section of the bar is going to represent those referrals given, and then the red section is those referrals not given. So housing, utility assistance, and food and meals are by far the most referred needs category in Southwest Virginia, West Central Virginia, and it's going to trend statewide that way as well. You can see where clothing and personal household needs, healthcare, individual, family, and community supports, legal, consumer, public safety, transportation. You're going to see, even so, because we're on a scale pretty big here, that even this is still going to be within the 500, 400 range of referrals given. So pretty good distribution, but knowing that those basic needs are really what people need the most help with. So again, kind of summarizing, utility assistance is #1 most referred needs category in planning districts 1, 2, 3, and 4 for Southwest region, and then flipped with housing being the most referred for those regions 1, 2, 3, and or those planning districts 1, 2, 3, and 4. So that just means that planning district 5, Roanoke Valley, is the oddball. It's just switched. Housing is #1, utility assistance is #2. They all remain kind of in line on 3 and 4, food and meals being the third most preferred, individual, family, and community support. So that's really our DSS programming. It's our AAA, so those areas on aging that really make up a great deal of referrals in that category. And then when we kind of break into different ones, healthcare is the top 5 most preferred needs category of Planning District 2 and 3. And then transportation broke into the top 5 needs category in Planning District 4, despite a very low referral success rate. And then mental health and addictions or substance use is the top 5 most referred need category in Planning District 1. And then legal, consumer, and public safety is the top 5 most referred needs category in Planning District 5. And so one thing that you may be aware of is that 211 Virginia was awarded funding for the opioid reduction registry. So when it comes to the mental health and addictions and substance use, we are putting some effort into getting more resources to address this and really making sure that people that maybe are dealing with these have the help and support that they need and know that they can access it through 211, which is another reason we're so excited to get a Southwest person on board for this region.
And over in West Central, you'll see fewer categories. These are pretty consistently our top 5. Again, utility assistance and housing are 1 and 2. That's going to be the case in every planning district across the state. In this case, utility assistance is #1 in Planning District 12, and housing is #1 in Planning District 11. Food and meals is always #3. Individual, family, and community support is always #4. And legal, consumer, and public safety was also always #5. So pretty consistent in our West Central region.
And most legal is always going to be, for them, not always, most of the time, a legal aid. And what we noticed within the last few years too is it's definitely going to be housing adjacent or very much housing related when we're thinking about evictions and landlord tenant issues and things like that too. And then when we look at needs categories with the highest referral success rates, we're looking at, again, that state average and regional average, and you can see where we are excelling 95% and above, all the way to 100%. And some of our probably less utilized categories, so again, thinking what can make your grade go higher is having it less utilized sometimes. So sometimes a percentage may be affected by a low number of requests for that needs category, especially when we're talking about the arts, culture, and recreation, employment, and information services, and volunteer and donations as well. And so I think it's important to note too, when we're thinking about who's utilizing 211, it's going to be those looking for basic needs because it's that ALICE population. It's those living below the federal poverty line. And so I think talking through, while this makes a whole well-being, it's really hard to seek out some of these things when you can't meet your basic needs too. So definitely keeping note of those, but also recognizing that these have space for improving quality of life and achieving economic mobility too. So these are just as important, though maybe not as utilized in our system. But we are successful when they do happen. So that's important to know.
And in West Central, you're going to see some of those same categories. And we actually, you won't see that little disclaimer at the bottom of the screen for this slide. I believe this is the only one today where you're going to see that. We did have at least 15 to 20 requests for each of these categories. So West Central population is really utilizing 211, utilizing all of these different categories. And you'll see the success rate, again, is 95% or above, and that's for the categories of employment, government and economic services, food and meals, which is great to see, one of our basic needs on there, legal consumer and public safety, information services, and then that mental health and addictions category. So once again, West Central coming through with some really well-served needs categories.
And then looking on the flip side, the needs categories with the lowest referral success rate, again, acknowledging our state average and regional average. Probably no surprise below at the 52% is transportation, especially when we're talking about such a rural area in Virginia. And then followed by around 71 to as high as 81% referral success rate when it comes to income support assistance, disaster services, clothing, personal household needs, and housing, of course. And so I will make a note with the percentages may be affected by a low number of requests for this need category with disaster services. We know that disasters, they happen immediately, but sometimes a response can be delayed, and certainly the recovery and how services kind of pop up. So they may call one day where it's not available, and 2 days later they've stood up something and it is available. And so that's why it is so important to kind of keep in touch when a referral doesn't work out, especially when it's such an evolving fluid situation like a disaster. And then for housing, of course, that's not going to be a surprise. And we do encourage you to look at these regional reports that kind of break it down so you can see farther some of the needs, since housing is such a broad category.
And in West Central, you're going to see a very similar list. So transportation is at a 61% referral success rate. This is more in line with what we're seeing across the rest of the state. You're typically going to see transportation fall within that 60 to 70% range, and it is consistently our lowest referral success rate everywhere in the state. Disaster services, once again, we do take that a little bit with a grain of salt because that's so dependent on when people contact us and if the resources are available. And just because we have an instance of a referral not given on one day, we might be able to provide them with that resource the next. So disaster services, we take a little bit with a grain of salt. And then our other categories are income support and assistance, clothing, personal and household needs, and education. I do, again, just want to point to how well served West Central is, that these are the 5 lowest success rates, and we have an 86% on there. So that means everything else on the list is higher than an 86%. So West Central we're really able to give referrals for most needs categories. It's just going to be kind of those 3 or 4 that you see listed there that we're paying attention to.
And so in summary, for community need, housing and utility assistance continue to be the most preferred needs category by far. They're followed by the food and meals and individual and family and community supports. Southwest Virginia has a diverse set of needs, with 8 of the 17 needs categories represented in the top 5 for at least one planning district in that region. We always kind of say it, we're a statewide team, but you can chop up Virginia and have a million different communities. And I think that this really speaks to that. Just when we think of a small, well, not small section, geographically huge section of Southwest Virginia within our state and how diverse those sets of needs are. Referral success rates were lowest for the categories of transportation, income support and assistance, and disaster services, which indicates potential resource scarcity in these categories. And I do think that we will see probably a lot more happening around disaster services, a lot more advocacy around that within our state and with our probably across the country too, as we had a great deal of devastation hit our areas in a short period of time throughout our state, but also throughout the USA too. So I think we will probably see those things trending, which is why this session and hopefully the takeaways from today are so important so we can make some advocacy and change in those areas that are so desperately needed. So to wrap up our Southwest and West Central, though we're here for a while with our next regions of the state, we made these presentations based off of our 23 and 24 planning district and snapshots and regional reports. And so at this Council of Community Services.org planning district reports, you can download and find all of the snapshots of planning districts. So one side is the planning district, the other side is just an overview of the region, and then 6 individual regional data reports that look like this but have different information. Today, you certainly got a whole lot more information than those reports show. So thank you for attending this session. So in those planning district reports, planning district overview, community need, looking at individual served contacts and referrals, contacts by locality, and then most referred needs categories. We'll also have, I think, those links to those in the chat. And all of our reports will be going, migrating to our new website, but right now they're on our employer and our nonprofit organization's website. We might host them on both. You can never have too much data, but they will be on our 211virginia.org once we transfer everything over in the new year. So to leave you with some calls to action and how you can help our communities all across Virginia is to increase awareness about 211 Virginia. Let them know that there is a place to find help and that resources are available in our communities. So you can scan the QR code, or I think we'll drop some links in the chat that you can request marking materials and get rack cards, posters, wallet cards to distribute all throughout your communities. Also, we talked a lot about resource scarcity and resource allocation and what that might look like in our communities and how we can expand our resource directory, and you can help us. So if there are local agencies that could benefit from partnering with 211 Virginia, we encourage you to scan the QR code or the link, fill out the link to recommend an agency. If an agency already exists, you can certainly search it in our searchable database, or you can contact any of us and kind of say, hey, this agency is great. Wanted to make sure they're in the resource directory. And then encouraging you to utilize our data, leverage our data to inform decision making, strengthen funding proposals, and enhance service delivery based on community needs. We have been known to write letters of support to get more funding in communities. So, or referencing some of our data points, referencing how often we're collaborating or referring to you all. There's a lot of ways to use our data to show need and also to bring more resources in our community. So we do encourage you to reach out, read our additional reports, but also don't be shy to ask us if data exists, because while I have probably been drug into this, I love data now, and I know Mary loves data, and we have a lot of people on our team who love data, so we'd love to get that to you, and hopefully with our modernization, we make that more accessible and readily available, because it's something we're certainly passionate about. And so I think we might be at our time, but we can take some questions too. I was kind of looking at it and I was like, oh, I hope I have a timekeeper because I will talk. So we will take any questions in the chat and we'll also answer them. And then we'll get ready to transition to northern and northwest. Well, you'll still have me and Mary, I believe.
Yeah, we do have, we can go ahead and give a good, I think, 10 minutes for Q&A. We can get started with Northwest and Northern just about 5 minutes late. We were going to give some time for people to come in anyway. I'm going to stop the recording, and yeah, please feel free to utilize the chat or the Q&A, and we've got some time to answer your questions.